All right, we are back with an important and timely Consumer Confidential. Our health insurance plans reset at the beginning of the year. So now is a good time to review your benefits. For me, it's like eating vegetables. You just gotta do it, right? Yeah. So here to explain what some common but confusing terms mean and tell us about important Medicare changes. We have senior consumer investigative correspondent Vicky Nguyen. Good morning to you.
Good morning, Chanel.
I'm not going to lie, you say insurance and I'm like, okay.
I know, we all want to glaze over, but we're going to do the 101
Let's do it. All right, so first we're going to start with the fact that it's hard to understand like the coverage, like how to break it down, right?
So at its most basic, right, health insurance is basically a plan that protects you from having to pay for the full cost of your health care, which at any given time we don't know what may or may not happen. So that's basically what it is.
You know, it's a hard decision where if you choose to pay more every month. That's like, it's just such.
I know.
It may make financial sense, but it's just like, why do I want to pay
Why do you want to do that?
Yeah,
well, typically people get it through either their employer or through the government, the Affordable Care Act or Medicare.
Okay.
And so the first term that you want to pay attention to is your premium, that plan. How much do you want to pay for what kind of coverage? Do you pay more now so that you can pay later less? It's going to be up to you.
Yeah.
The next term to think about is the copay. So that's the fixed cost you pay for every doctor's visit if you have to go to the ER. Your copay does not apply to your deductible. People sometimes wonder about that.
Not the hard way?
Yes. Your deductible, often insurance companies require you to pay a certain amount, $1,000, $2,500, depending on individual or family coverage, before they kick in and start chipping in money towards your health care.
And that can hurt if it's high because, you know, you feel like I've been going to the doctor.
Paying and my insurance isn't kicking in. Exactly. And then finally, the out-of-pocket maximum is exactly what it sounds like. That is the most you will pay. Once you've hit that dollar amount, after paying your deductible, the insurance company pays for 100% of your care. But remember, that resets every year.
All right, so 101 set.
Yeah.
Okay, so Vicky, for the folks 65 and older, government announcing changes for Medicare Advantage.
Yes.
What are those changes?
A lot of positive changes, Al. So the government passed the Inflation Reduction Act last year. It takes effect this year. It means the government has more power to negotiate for our prescription drug prices. So we're going to see costs come down on things like blood thinners, cancer medications, and the all-important insulin. So that is really
Is that for everybody or just Medicare?
That's folks on Medicare.
Okay.
The deductible for Medicare Part B also comes down. It's the first drop in a decade. It's only $7, but the deductible is now $226. This I really want folks to pay attention to. So the recommended vaccines, including shingles, which can cost up to $200 for the 2-dose course, that's now free. Same with your COVID-19 vax, your flu vaccine, your pneumonia vaccine. So take advantage of the free vaccines. And finally, insulin copays capped at $35 a month. But not for all insulin, so ask your doctor about that.
Okay, so we sign up for everything. We've just, put our hands in the air. Fine, this is what I have. How do you make the most of what you signed up for?
You got to do the thing where you set aside an hour or two to really walk through your plan and know what your coverage is, know who the in-network providers are versus the out-of-network providers. The good thing about COVID is it made a lot of our telehealth visits free. That is now covered by insurance, so take advantage of those. And the next thing is know the difference between an FSA and an HSA, like the flexible spending account versus the health savings account. That's all tax-free money. The HSA is your own. You can take it, doesn't matter where you work. The FSA is attached to your employer. You have to use it or you lose it every year. But it's great if you know you have health costs coming up. You put aside that money. It's not taxed. It lowers your taxable income. Finally, get around to scheduling the OBGYN visit, the physical. Just get that done.
It's included.
It's included. Preventative care is generally always covered at 100% with insurance. And then lastly, we know prescription drug medication pricing is so opaque. It's all over the place. List out all your medications. Ask your doctors whether you can take generics and go online. Sometimes using your insurance is not the cheapest way.
Okay.
One of the leading causes of bankruptcy in this country, medical bills.
Yeah, they get out of control easily.
Especially after procedure. Are those bills negotiable at all, Vic?
This is so important. They can be. And here's what you need to do. First, you need to know what is your bill, exactly line by line, the items. You've heard those stories about getting charged $15 for one ibuprofen pill. Highlight everything that is wrong or seems exorbitant. Then you're going to go to, there's a couple of websites I want to tell you about, Fair Health and Healthcare Blue Book. That'll tell you how much these procedures are supposed to cost in your area. Then you call the hospital, right? And you say, okay, Here's what it should be. What can you do for me? Be polite, be firm, be persistent.
So these two websites tell folks what they should be paying.
In their area. Because, of course, a gallbladder removal somewhere is not the same as it is somewhere else, which is frustrating about healthcare. Then ask if you are below a certain financial level, you may be able to lower the entire bill. And, of course, set up a payment plan if that's going to be what makes it easier for you to pay. And finally, there's a whole industry called medical bill advocates.
Okay.
If you're caring for someone who has a lot of medical bills, or maybe you're too sick to deal with all of this yourself, sometimes the cost of hiring one of these companies to do the negotiation for you will save you more in the long run.
Really quickly, we just want to show folks some of the items, just to remind folks that are not covered by insurance.
Definitely not cosmetic procedures. Last week we were talking about buccal fat removal from your cheeks. That's not going to be covered. What I was so surprised, fertility treatments often are not, and also elective procedures, the shoulder replacement, the hip replacement, sometimes that's considered elective. They don't cover it, right?
Well, it depends. If your doctor, they work with you to
exactly. You want to make sure you know before you go into that kind of surgery.
Gotten their money's worth out of their insurance.
That's like the bionic
worth every penny. Worth every penny.
Testing it.
I know. I just have a rolling appointment with doctors. I'm just here. There'll be something wrong. Vicky, thank you so much. Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.